All right, let's get into it. Today, we are tackling a huge topic in men's health, testosterone replacement therapy, or TRT. We're going to cut right through all the noise online and focus on what is, without a doubt, the single most important decision you will make on this journey if you're in Australia.
So here's the thing. For some guys, TRT is absolutely life-changing. It brings back their energy, their mood, their drive, everything. But for others, it can be a total nightmare, a frustrating cycle of side effects and just, well, not feeling any better. So what's the deal? Is it a miracle medicine or a risky gamble? The answer, believe it or not, is actually simpler than you'd think. And there it is. The single biggest thing that separates a success story from a horror story isn't the specific type of testosterone or even the dose you're on. It's the clinic. It's the doctor you choose to guide you. Your provider is everything, and in this explainer, we're going to show you exactly why that is. Okay, first things first. The absolute foundation of any good treatment is getting the diagnosis right. And trust me, this goes so much deeper than just looking at one number on a blood test. A responsible clinic knows that figuring out why your levels might be low is just as important as the number itself.
Now, a lot of men start looking into TRT because they're dealing with stuff like this, right? The constant fatigue, no energy, the brain fog, the low sex drive. I mean, these things are incredibly common and they can completely wreck your quality of life. But here's the catch. These symptoms don't automatically mean you have low testosterone.
And this is what's so interesting and what makes the diagnosis tricky. That fatigue that's hitting you every afternoon? Yeah, it could be low T, but it could also be something like untreated sleep apnea or just chronic stress. A great clinic acts like a detective. Their first job is to rule out all these other potential causes before even thinking about writing a TRT script.
So a real diagnosis stands on these three pillars. You've got to have comprehensive blood work that looks at the whole picture, not just your total testosterone. We're talking about key things like LH, which tells your body to make testosterone, and SHBG, which controls how much of that testosterone is actually free and available for your body to use. It's also not a one-and-done test. Your levels can change day to day, so you need at least 2 separate tests, done in the morning. And finally, a good doctor looks at you, your symptoms, your lifestyle, your whole medical history, not just a page of lab results.
Okay, so let's say you've got a confirmed diagnosis. What now? Well, in Australia, you're basically looking at 2 very different paths for treatment. And honestly, they're worlds apart in how they work.
And this table just lays it all out. On one hand, you've got the traditional public route through a GP and the PBS, which is the system that subsidizes medications. The problem here is the criteria are incredibly strict. Your testosterone levels often have to be rock bottom, like below 8 nmols per liter, just to even be considered. And then you're looking at long waits for specialists, and often older, less flexible treatment plans. The other option is a specialized private clinic. They tend to look at the bigger picture, your symptoms and overall health, not just one number. Access is way faster, and they typically use more modern, personalized protocols that are designed to keep you stable and feeling good.
So this is the big question, right? If you're thinking about the private route, how do you sort the good clinics from the, well, not so good ones? You need a blueprint, a checklist of what you should absolutely demand from any provider you're considering. This quote right here, it hits the nail on the head. You have to shift your mindset. You're not buying a product off a shelf, you're entering into a long-term medical partnership. TRT is serious medicine that affects your entire body, and it absolutely requires continuous professional care. So, this is your checklist. These are the non-negotiables. A good clinic will have a rigorous screening process to make sure it's safe for you. They'll have a smart dosing strategy that starts low and adjusts based on how you respond, because everyone is different. They'll have a crystal clear plan for routine monitoring with blood tests, and so important, they'll provide ongoing support so you're not left alone trying to figure things out from a random forum post at 2 a.m.
And that monitoring plan? It's not just a vague promise. It looks like this, a concrete schedule. A trusted provider is tracking way more than just your testosterone. They're watching key safety markers, like your red blood cell count to make sure your blood isn't getting too thick, and your PSA, that's your prostate-specific antigen, to keep an eye on your prostate health. This is what comprehensive, long-term safety looks like. It is not optional.
Now on the flip side, you have to know the red flags. These are the signs that should make you think twice. Any provider promising a miracle cure with barely any testing? Run. Anyone starting you on a massive dose from day one or using the exact same plan for every single patient? Big red flag. If they get vague about follow-up plans or try to pressure you, you know their priority probably isn't your long-term health. This is where that blueprint really comes to life. The best providers out there have built their entire model around this clinical-first approach. They're focused on your safety and getting you sustainable results, not just selling you on short-term hype. For instance, clinics that live by these rules, like AustralianTRT.com.au, have a process, from the first screening to the ongoing monitoring, that's all designed around your long-term health. That patient-first model is the gold standard you should be looking for.
All right, let's talk about the end game, because a successful outcome on TRT might not be what you think it is. It's time we redefine what winning on this journey actually looks and feels like.
The real goal isn't about chasing some crazy high number on your lab report, like it's a video game high score. The goal is to find the lowest dose that works for you, the dose that relieves your symptoms, keeps you feeling stable, and keeps all your health markers in a safe range for the long haul. It's about stability, not just a big number.
So this is what a good outcome actually is. It's finally getting consistent relief from the symptoms that made you look into this in the first place. It's having stable energy and mood, not feeling like you're on a hormonal roller coaster. It's the peace of mind knowing all your health markers are being carefully watched. And it's feeling like you have a professional, accountable team in your corner for the long run.
Look, let's be real. Your journey here probably started with a lot of confusing and frankly conflicting information you found online. It can feel like a maze. But you deserve so much better than guesswork. You deserve a clear, safe, evidence-based path with a real medical partner who is guiding you every step of the way. And that really brings us to the final question you need to ask yourself. As you think about what to do next, is your goal to find a quick fix? Or are you looking for a credible, long-term health partner who will help you manage this safely and effectively for years to come? The answer you give to that question will define your entire experience.